Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Eustachian tube, and let's compare the infant as well as the adults. So we begin with the infants. So in terms of the infants, the length is going to be 13 to 18. So the unit is always mm. And what will be the angle with the horizontal? Angle with the horizontal. So angle along with the horizontal is going to be 10. That is, it is more horizontal. 10 degrees, that is more horizontal. And what it normalizes at 7 years. It normalizes at 7 years. Then how is the isthmus? The isthmus is going to be straight. The isthmus will be straight. And how is the width? The width is going to be wider bony part. So isthmus is going to be straight and the width is going to be wider. So there's a wider bony part. Now, what about the cartilage? So in terms of the infant, the cartilage is going to be flaccid. So cartilage is going to be flaccid and the elastin at roof. The elastin at the roof. This is going to be less dense. This will be less dense. Next is the Ostman's pad of fat. So there is something known as the Ostman's pad of fat. The Ostman's pad of fat is going to be less in volume. This will be less in terms of the volume. So to just summarize the infant ET, the length was 13 to 18 mm and it is more horizontal. Next, what we saw is it is wider width. So we are just highlighting some important points. So then the Ostman pad of fat is less in volume. Now let's look at the adult ET. That's a Eustachian tube. So in terms of adult, it is the length obviously will increase or it will double, that is 36 mm from 18. So the angle with the horizontal is going to be, this is going to be 45 degrees. Whereas in terms of infant it was 10 degree, in adult it is going to be 45 degrees. So how is the isthmus? The isthmus is straight in terms of infant, whereas in terms of adult it will be angulated. So adult A and this is angulated starting with A. So how is the width? In terms of adult, the width is narrow. So in terms of adult, the width is narrow and the cartilage is going to be rigid. So width is narrow, cartilage is rigid. So cartilage is going to be rigid. Next is the elastin at roof. So how is the elastin? The elastin at roof, this is going to be very dense. So this will be very dense. Next is the Ostman's pad of fat. The Ostman's pad of fat, this will be more in volume. So it is more in terms of volume. So to just recap, the adult ET was 36 mm, the diameter formed was 45 degrees, angle with the horizontal, and the elastin at roof is very dense. To learn and grow daily like this, please do subscribe.